Okay, in this last video, we'll talk about some of the sex hormones, and then we'll talk a little bit about inflammation, and we'll finish up with some endocrine disorders, okay? So in terms of the sex hormones, remember the ovaries and the testes are the two primary gonads. The ovarian hormones are primarily estrogen and progesterone, together with gonadotropic hormones of the anterior pituitary. They regulate the female reproductive cycle. They're designed to maintain pregnancy, prepare the mammary glands for lactation, and promote the development and maintenance of the female secondary sex characteristics. In terms of testicular hormone, primarily testosterone, that's going to stimulate the descent of the testes before birth. It's going to regulate sperm production. It's going to promote the development and maintenance of the male secondary sex characteristics. Okay, and we'll get into a little bit more when we get into reproductive, male and female, into more of their functions. But for right now, that'll whet your appetite. Now, in terms of miscellaneous hormones, we have to talk about something called eicosanoids. Um, there are local hormones that are released by all body cells. We'll talk about leukotrienes, and we'll talk about prostaglandins. Now, leukotrienes influence white blood cells, like leukotrienes. They influence white blood cells and inflammation. Prostaglandins are going to alter smooth muscle contraction. So think of blood vessels, think of the uterus, think of the digestive tract. They're going to influence glandular secretions, blood flow, platelet function like clotting, nerve function. Now, ibuprofen and other non-steroidal anti-inflammatory drugs, those are called NSAIDs. NSAID for non-steroidal anti-inflammatory drugs. They treat pain, fever, and inflammation by inhibiting prostaglandin synthesis. Let me show you how this works. So we have arachidonic acid that's in every cell membrane. Okay, every cell membrane, you have phospholipids, and within the cell membrane is also arachidonic acid. Some people have more arachidonic acid, some have less. If you're on a good, healthy Mediterranean diet and you substitute omega-3s and omega-3 fish oils, you can actually offset the amount of arachidonic acid. So people that are eating healthier and have those good omega-3s in their system, they may not have as much inflammation as other people. And that's because that Mediterranean diet is an anti-inflammatory diet. Omega-3s are anti-inflammatory. So on the top, it says arachidonic acid is metabolized to produce inflammatory mediators. Many current anti-inflammatory and pain medicines inhibit some portion of the arachidonic acid pathway. So there are these two main branches. Offshooting to the left, we have prostaglandins, and offshooting to the right, we have leukotrienes. Now, how do we go from arachidonic acid to prostaglandins on the left, and how do we go from arachidonic acid to leukotrienes on the right? Well, going from arachidonic acid to prostaglandins on the left, we need an enzyme. It's called COX, cyclogenase 1 and 2, COX enzymes. How do we go from arachidonic acid to leukotrienes? Enzymes, LOX, lipoxygenase. You see it there on the right. When arachidonic acid is converted by the COX enzymes to prostaglandins, you're going to have pain, inflammation, and swelling. If you take a COX inhibitor like ibuprofen or aspirin, you can block those prostaglandins. So you have decreased pain, decreased swelling, decreased inflammation shooting off to the left. But what happens if you take aspirin? Too much aspirin. Can't you get an ulcer? Yes, you can get an ulcer. Why is that? Well, prostaglandins have normal function. They produce mucus in the stomach. Mucus in the stomach protects the stomach from digesting itself. Well, how the heck can the stomach digest itself? Well, the stomach can digest itself because of the stomach acids. Haven't you wondered why the stomach doesn't digest itself? I mean, it's got this hydrochloric acid in it. What protects it from digesting itself? The mucus. Prostaglandins produce mucus. But if you're taking a prostaglandin blocker like aspirin or ibuprofen, there's no mucus production, and all you have is the hydrochloric acid. And then the stomach starts to give itself an ulcer from its own hydrochloric acid, its own low acidic pH. Now, to the right, arachidonic acid can be converted to leukotrienes, and leukotrienes are also involved with inflammation, but typically inflammation around the airways, like the trachea and the bronchi. So you get airway obstruction, you get like asthma, you get that wheezing effect when the airways get blocked. So people that are asthmatic take these leukotriene blockers. They take these LOX inhibitors so that they don't get airway constriction. Okay, so inflammation is a natural part of healing. We all want inflammation. Acute inflammation is good, chronic inflammation is bad. And it's mediated by bradykinin. Bradykinin is what creates pain. Pain creates inflammation. So bradykinin is going to bind to this G protein, this G reactive protein, and stimulates phospholipase A1. Now remember, I said cell membranes are phospholipid bilayer. So phospholipase, anything that ends in ACE, is an enzyme, is going to break down that cell membrane wall and release arachidonic acid. And arachidonic acid, as we saw here, can be broken down into these prostaglandins or leukotrienes, creating inflammatory responses. We know that when people take aspirin or ibuprofen, aspirin was discovered in 1971, it inhibits the prostaglandin synthesis, right, without affecting the leukotriene pathway. We know that ibuprofen and aspirin can treat a variety of inflammatory disorders like rheumatoid arthritis. We know that aspirin can treat fever because prostaglandins raise your temperature. Prostaglandins create pain. Prostaglandins produce mucus. Prostaglandins create uterine contractions. So now if you take aspirin, you block all of that. Some good effects, but there could be some bad effects as well. We know aspirin overdose can create tinnitus or ringing in the ears. We know that it can thin the blood. It can create little micro tears in blood vessels in the brain, causing even strokes. Now we'll finish up with some endocrine disorders here. When we look at the top left, we'll see giantism. We'll see too much growth hormone. When a person is younger and they have too much growth hormone, they grow really, really tall. In letter B, in the top middle there, when there's too much growth hormone in an adult, they get that thickening of the skull, the thickening of the brow. They have that like cavemanish type of appearance. That's called acromegalia or acromegaly. On the top right, when the thyroid is enlarged, we call that goiter. That's typically seen with iodine imbalances. That's goiter, an enlargement of the thyroid. In the center on the bottom, where you see that looks like the bulging eyes, that's called exophthalmos. That's seen with a hyperactive thyroid. We see that in a disease called Graves' disease. And then on the bottom right, we see that from excessive cortisol, whether it's endogenous or exogenous, it's called Cushing's syndrome. Here is that bulging look of the eyes where you can see the white of the eyes all the way around. That's called exophthalmos. Here is Cushing's, where you see that round moon face, the reddish cheeks, thinning of the skin. You see red striations, what looks like stretch marks around the stomach, around the breast tissue. We see a real pendulous upper half of the body, like a big, big belly, but then you see much thinner lower extremity. You see thin arms and thinner legs with too much cortisol, too much glucocorticoids. You get that fat pad at the base of the neck. They call it a buffalo hump with Cushing's syndrome. It looks like this in real life. You could see that round face, the reddish cheeks. You could see the thinning of the skin, the purple striae under the arm, the purple striae around C, around the belly, and in D, you could see that buffalo hump. Okay.